Welcome to the AUA News Inside Tract podcast, an official podcast of the American Urological Association. Thanks for listening. For more episodes of this podcast, visit www.auanet.org/podcast.
So hello, thank you for joining us for AUA Inside Tract. My name is Andrew Lai.
And my name is Raven Jones.
And we're thrilled to be here. You may have heard us about a year ago on Voices. It's such a pleasure to be invited back to talk 1 year later.
Yeah.
Gosh, so much happened in the last year.
There has been a lot. There's been a few significant things.
Many significant things. Wow, so Raven is now a big timing attending.
Yes, I have entered practice.
Wow.
I'm board eligible. Both of us are board
We're
eligible.
both board eligible. That's great.
Big deal.
Celebrate that.
Big deal for sure. So I've been at work on my own mostly since like October.
Okay, yeah.
Oh, what the math is. About like 8-ish months, I guess. Wild. I know.
Yeah, insane. And in that time, I've been a genitourinary reconstructive fellow at the University of Chicago. Fortunately, it's only 1 year. I think the biggest difference that we've experienced probably was that we've been apart.
Yeah.
We've been apart for the last year.
Yeah, it's been a real challenge.
It's been a real challenge. I'll text you, and I know you're probably really busy because I don't hear from you for like a day, and then afterwards, like you're like yes, and you'll give me like a one-word answer, and I'm like, oh man, she's so busy.
Yeah.
I
think, I was thinking about next year or this upcoming year. Which we could talk about in a little bit. But I was like, I think this is the only time that we have done urology apart. And it's really strange. Like I was like, wow, I don't know if I actually know how to be a urologist without Andrew. Which is
not true.
I guess true or not. Yeah, I guess I do know how to be a urologist. But it's like a very different thing to just not have your person there all the time.
Yeah.
And to be geographically very split as well, because I'm on the West Coast now and Andrew is finishing fellowship in Chicago still. But that's all about to change.
I think it's about to change because I'm about to join Raven's group.
Yep.
Yay!
All right, okay, cheers.
Cheers to that. Cheers to that. And not only that, we are about to live probably. Did we calculate? It was about it's an 8-minute walk.
Yeah.
8-minute walk
But
away from each other.
Drive. Yeah.
Everybody who knows us right now is like,
yeah.
Or of course they're like
in the back of the head. But honestly, it just worked out beautifully. We were in need of a reconstructive surgeon in our group, and you just happened to be available. So
sometimes the universe just like lays down the cards for you, and the cast is there, and you just need to walk it.
Yeah. So every day at work, I'm like, oh, I need to write that down because Andrew's going to have that question next year.
Yeah, I really appreciate you laying all this groundwork down for me.
And I'm like, okay, all the codes to all the doors, all the like sneaky ways to like get things done efficiently.
It's interesting you say that because like, so we were at UIC for 6 years and we knew everything about it. We knew everything. We knew the schedule, we knew how things worked. We knew when the nurses got off and when their shift changes was. We know when the OR nurses shift change was versus the floor nurse shift change.
Which supply closets had the exact dressing supplies we needed.
Yeah, that closet doesn't carry 13 French.
No, it doesn't.
And then going to a new institution for 1 year for fellowship and just not knowing anything at all. Like I knew what I needed to do to deliver patient care, but I just didn't know how to do that. And that was something that I took for granted for 6 years.
Yeah.
And had to relearn it. And so now looking forward to being an attending in the fall and having to relearn that. I very much appreciate having someone who's already done that for me and can just tell me what.
Yes.
I also just love that, like, you'll just text me and be like, hey, I have this situation with a patient. Like, what would you do with this situation? And it's really nice. So just like, oh my God, like, we're gonna, oh yeah, of course. We're
like, how am I supposed to handle patients without you? Yeah, I'm surprised I handle as many without texting you, truly.
Honestly, I'm surprised that you text me at all about patient care because I think you can handle it all on your own. You are such a good surgeon.
Well, I think it is I mean, obviously there's codependency. Like we can each talk to our respective therapists about that. But I think we just got really good at collaborating. And I think we're also really used to reaching out and getting other people's input.
Yeah.
And that was something that was really cool. And I told you that your future boss, my boss, like one of my like first weeks in the office, she comes in and she's like, hey, can you look at this CT with me and like tell me what you think? Like, what would you do in this situation? And it wasn't a test. I was like, oh my God, is this a test? But she was legitimately asking for help and like just trying to figure out, because not everything is a test question. Not everything is clear cut.
Or textbook.
Right. Not every patient reads the textbook. And I think it just went to show that I ended up in the right place and that you're going to end up in the right place, because that's what we're used to,
Yeah, that's really reassuring.
is reaching out and like trying to, crowdsource, but also like you use your own brain, but it's also really nice to have different perspectives, because people be complicated.
Do be complicated, and they don't follow what you're
Yeah.
learned in medical school or in
Yeah.
residency. Yeah.
Sure.
And definitely in fellowship. They
Right.
don't follow it.
How has fellowship been?
Fellowship has been really, really interesting. I think overall, it's been just an incredible experience. I think it's presented itself with new challenges, of like different opportunities for growth, of, kind of putting me in situations where I had to have crucial conversations. And that was thing that I just like, I don't even think I had mind share in residency to really understand or to really kind of wrap my head around. And I have a little bit more mind share in fellowship to be like, oh, like this is something that's really been an issue. Like I need to talk about it.
Yes.
I've also found myself in this weird kind of intersection where you're a teacher and but you're still a student, right? So I'm still learning and I'm still trying to get as much out of specific surgeries or specific clinical pathways or clinical disease processes, and really trying to master that. But at the same time, I have a whole team of residents that are looking to me for like
the answer
or like the what to do next. And sometimes my answer is, I don't know. We gotta ask.
It is.
Yeah.
Sometimes it is. I don't know.
So sometimes I'm just like, I don't know what I would do. But then other times I have to remind myself that, yeah, actually, I do know the answer.
You are well trained. You are well equipped.
Yeah. And sometimes I'll talk to the chief residents. I actually remember a couple experiences where we arrived at different clinical plans, but both were actually good plans.
Yeah.
Moving forward. And again, it's in those situations where the patient didn't read the textbook and it's a really complicated or an interesting or rare situation of like, what would you do in this situation? And it's actually been really nice to kind of collaborate with them as well. So like, I'm still very much a student. I'm still looking forward to be a student.
Yeah. I don't think it ends.
I don't think it ends at all. It's not going to end. No. In general, I think surgery is really humbling.
It is.
And that's a quote from a trauma surgeon from Sinai when we trained.
Yeah.
Surgery is humbling. So I feel like we still will have so much to learn in our careers. We're so young yet.
We are so young.
No, I don't think you're young enough.
Every day my patients are like, oh, you're so young. I'm like, it's the Botox. I'm secretly 55.
No, you're not.
You have no idea.
No. We are forever 20. We are for 20. Or at least as immortalized our bobbleheads. Shout out to Matt Delpino for...
Yeah, one of our sweet junior residents had these made for us when we graduated a year ago from residency.
It's insane. It's insane. I was counting. We started medical school over a decade ago.
Yes. Yeah. For me, it was 12 years ago because I did 2 research years, I guess.
Oh, wow. Yeah.
A long time ago. Wow, how the world has changed.
Wait, so then, okay, looking forward to be an attending, asking someone who is already an attending.
Barely.
What sort of like high point advice would you give me? Yeah. About to start, right? Like, and everybody else who's kind of in my position.
I feel like I'm still in that position, but you also learn so much so quickly, like just like when you start residency, and I'm sure when you first start fellowship, like the learning curve is massive because you just have to figure out the expectations of you and how to meet those expectations. And I think no matter how well prepared you are in residency, you just aren't prepared for a lot of what you're talking about. Like my first conversation where I had to tell someone that their cancer was inoperable or that they had, something that was more aggressive than we thought it was or something like that. Which I hate cancer conversations, but that's for another podcast. But I mean, I like it when I'm helping patients to like, pee and have sex, right?
Yeah.
But the life and death stuff still exists in urology. And I think when you realize that you're the one that the patient is looking to for all the answers, I think you realize how much you don't know and the answers that you don't have. And so that was really hard for me. I was texting my friend who's in palliative care, and I was like, how do I have this conversation with this person?
Yeah.
And she provided some really good pointers, but that's a little bit of a tangent. I think just be okay with not knowing, because you're not going to know. There's so much you're not going to know. And to our point earlier, when it comes to collaboration and asking, like, I know for a fact that I'm in a group where I can ask those questions and be like, hey, how does this work here? Hey, who normally does this here? How, like, what are the expectations? Am I being silly asking this question? Whatever.
Yeah.
And I ask those questions and they come back to me honestly, and there's no judgment.
Yeah.
That's really valuable. So you're going to have that. You're going to be able to ask those questions, start with me, and then we can ask anybody else.
I'll just walk down the street.
I mean, yeah, honestly. Oh, thank God. But also, like, I mean, we're good surgeons, right? We're always refining our craft. Like, we're always going to be learning in the OR. But outside of the OR, it is really profound how much we don't know. When we know the pathway, like overactive bladder, for instance. We know we're going to start patients on meds. We know the workup. We know the next step. But the patient's like, wait, how long is it going to take for me to notice a difference on this medication? Wait, is it safe for me to take this medication with this other medication? Or wait, I really love tomatoes. Can I still eat tomatoes while I have overactive bladder? Like, it's like the things that matter to people are way different than what we're tested on and what we're used to. So I think having those conversations, I mean, I spent a lot of time in clinic as a resident, I think I did, but having those conversations day to day, and people constantly surprise you what they care about constantly.
Wow.
Yeah.
That's such a good perspective and such great advice. So like
just prepare not to know, prepare to be surprised.
Yeah.
And also like, don't judge. I had a really hard time judging myself initially and being like, what is wrong with me? I obviously can't do this. Imposter syndrome, call it what you will. But it was very much like, I had the expectation that I should know everything when I walked in because I'm a surgeon. I'm a well-trained, like, look at me go. But you're never going to know everything.
Yeah.
And it makes perfect sense to not know everything. Even though you've completed residency, guess what? You're in a whole new position now.
Yeah.
That was humbling.
No, absolutely. Yeah. I feel like I went through the same thing with fellowship as well, going through this imposter syndrome, being like, do I know how to do this? And I'm really kind of like, I feel like I don't know how to do this. Wait, actually, do I know how to do this? And I feel like I'm 9 months into fellowship. And I have to constantly still say, yes, Andrew, you know how to do this. Yes. Like, you've done this before and you've taken notes on it, and like you even reviewed the notes on it before doing this surgery. You know how to do it, right? Yeah. There is a little bit of that mental battle. Why are we our own worst enemies?
Yeah. Wow.
I don't know. I feel like that might be a hallmark of a surgeon, is being so critical of yourself. But actually, that is pretty that's quite universal.
I will say that I'm struggling to find, or I think I struggled and I've kind of landed in a good place. But I think I really struggled initially when I had some complications that I just wasn't expecting, right? It just kind of came out of the blue. It's like, okay, well, everyone's going to have complications. And I'm like, yeah, but I did this right. I know I did this right. Yeah. And it's something terrible still happened.
Yeah.
And I think for me, I've had a lot of conversations with colleagues and friends about finding the balance between not judging myself and getting down on myself enough that I let my skill, my work suffer, but then also being humble enough to recognize that I'm not perfect and that things aren't going to go perfectly all the time.
Yeah.
Which was really challenging for me because I think my patients deserve the best. They deserve perfection. They really do. But like, I'm not a perfect anything.
I want to brag about you because I remember the conversation that we had for the very first time that you had a complication.
Yeah, my own in the OR.
Yeah, I remember you calling me about this and talking me through this and just being like, oh my God, I can't believe this happened. But then without replaying everything, I just remember being like, okay, hold on. First of all, the patient is stable. You did the exact right thing for that situation.
I did.
You called for help.
I did.
You recognized that you needed help. You called for help.
Yeah.
And you got through the situation safely. The patient is doing well. And I remember being so effing proud of you because I was like that, like not like, yeah, I remember you were saying stuff like, I can't believe I had this thing. I can't believe.
It's awful.
But then I remember being like, I'm so proud of you for navigating this because you will have a complication. Like you will have that situation happen to you.
It's true.
And you did the right thing. You still did the right thing.
Yeah. I hate that it happened, obviously, but we can't prevent all the terrible things as much as we try.
Right.
And so you're right. Like having the ability to navigate it, recognize it, address it, and then get through it.
Yeah.
Was a learning experience for me.
Well, I'm gonna call you the first time I run into trouble. No.
I was like, I'm by myself. I'm in this room. I've made something went wrong.
Yeah.
And I called my colleague who's my mentor, who's on call that day, available. She came down and she was like, what do you want to do? I said, I'm going to do this. This is what we're going to do. We're going to fix this. And we did it and it was fine.
Yeah.
So anyway, I'm more than ready to be that person for you. Next time I have a complication, I'm going to call you right away. But yeah, that was it's humbling.
Yeah,
right?
It is humbling.
It sucks to be the surgeon in the room. You can't be like, oh, a resident did this. You're like, okay, hi, anesthesia. We're gonna need to open.
Yeah.
We're gonna need to X-lap.
Yeah.
Hey, everybody, let's get the trays we need.
Yeah.
Like, I like making the call and saying, this is what we're gonna do. This is how we have to fix it. In that moment, I was like, it felt like somebody else had taken over. But it made me feel better because I knew that I had the training to like let that kick in to fix things. So
I'm so proud of you. I really am.
Likewise.
You're such a good surgeon. That's a hallmark of another good surgeon. Like you recognize when you need help, you did what you needed to do, and you navigated that situation really well. And like I think sometimes actually when like being a fellow, sometimes like the residents ended up calling me for help for situations rather than calling the attending directly. And like I feel like it's weird being on that other side, but as urologists, as a field, we're constantly on that other side, right? The difficult Foley, the ureteral entry or bladder entry, what have you. But
what happens when you make the mistake?
Right.
You know what I mean? Like what happens when you have to call someone else?
Yeah.
That's really humbling.
It is, I bet, yeah. It is humbling. It is humbling.
But we know what it's like to be on both sides of that.
We do.
I think we know more than, well, at least we both know more than I gave myself credit for. And now I'm able to be like, okay, fine. Like I handled that. Okay. Like,
and you can do it again.
Move on. Yeah.
You can do it again. And you can help me next time. But it also speaks to like, we're gonna name drop Jen. But it speaks to her for being able to come in and be like that calm kind of 2 feet on the ground anchor. And that's something also to think about too. Like I guess when we walk into the OR for the next time, OB calls us and say, hey, we hit the ureter. And like
for anyone else.
And like maybe, like I mean, I feel like in life, like it's sometimes nice to be the one called for help, and like sometimes you have to be the one with 2 feet on the ground rather than the one who's kind of trying to gather their nerves because something bad happened, like they were the ones responsible for something that happened.
But it's also humbling in that moment. Because we know what it was like to be on the other side.
Absolutely.
It's like you walk in and you don't want to be like, well, what do we have here?
I know. Right.
You walk in, you're like, hi.
Yeah.
Everything's going to be okay.
Yeah.
How can I help?
Yeah. I'm actually reminded of there's a book. One of the chapters talked about negotiation, and there's a whole point to me bringing this up. Is like the voice that you use in that situation really does matter. And the author called it his radio voice, and it's kind of like a lower calmer voice that's a little bit slower,
like an Obama voice.
Really much like an Obama voice.
Wow.
And in that way, kind of subconsciously, you're bringing a little bit of like a little bit of comfort, and grounding in that conversation, when no matter what that conversation where you're like, and that's in this situation, it was a high stakes negotiation.
Yeah.
In our situation, it will be in a surgery room where we walk in and we're expected to be like the one that digs out of the situation. But it reminds me of that, and I feel like that, I don't know, like going through these types of mental exercises and
No,
talking
that's
about it. I mean, it's just nice to hear about it, because again, surgery is humbling.
Yeah. Never, like, I will never not be honest about my shortcomings or like mistakes or like things that I've learned, because I think it's so valuable to
Yeah.
share that, especially with people who are coming up behind you
Mhm.
and being like, listen, this was my first my experience, my first year. Like,
Mhm.
please learn from it, whatever. So,
But I think patients will also really
yeah.
respond well to that, right? When they recognize that, oh, well, this is the limit of what we know, right? Or this is the part where it's a little bit of a murky water that we're wading in together.
Yeah.
And if you're upfront and honest with it, I feel like that only builds trust with patients rather than
Yeah.
misleading them and compromising patient care and a relationship.
I completely agree. Yeah. I've only learned that and leaned on that more, I think, being an independent practice now, like being my own individual person who's like making the decisions. It's like, okay, I have to be very, very frank with somebody and be like, hey, this medication might not work well for you. And here's why. Or, hey, I'm even this, like when I was on call last week, there was a lady who may or may not have needed a stent. I was like, I don't know, it's kind of gray area. Like, I don't know if this is gonna help you. And she was like, well, what do I do? You're the doctor. Tell me. And I was like, well, here are the risks. Here are the benefits. Let's figure out if you want to take this risk or not. So yeah, and there's so much of that in urology, which is good and bad, that there's plenty of ways to skin a cat. There are multiple routes, like you mentioned, to get to clinical improvement or efficacy. So anyway, that part has been enlightening as well, is seeing how other people practice and then learning, like, oh, like we both kind of accomplished the same goal. As long as we're both following guidelines and but it's like, you do learn there's so much gray area, and medicine and surgery even is so much of an art
Absolutely.
versus a science. I mean, more for you. You're like crafting new tissues and
But I mean, I think it's all within the same realm, right? Like the patient's still at the center of all of this, and I mean, the types of surgeries that you love and the types of surgeries that I love are mostly quality of life types of surgeries. Like our goal is really to help patients, right, in and navigating the rest of their life, right? It's not a life or death situation. And so we do have to have a lot of these conversations where we're like, okay, well, this is what the literature shows it may help you, or this is the probability, or this is the risk that we're asking you to take on if you decide you want to go forward with XYZ. So I feel like it's all within the same realm. And I think we're all speaking to the same thing, where patients are still very much at the center of everything. And medicine is not a 100% science. And if it were, like, then maybe AI really could really take it over.
No, it's so true though. It is. If it was black and white, if there wasn't this gray area, then sure, anybody, a machine could do it.
Yeah.
But there's a lot of the I figured out, I don't know if I showed you, I figured out how to look at my reviews. I know, don't do it. Well, so you can do it where you only look at the 10 out of 10 star ones, which is all I care about. Like, my boss can read the negative ones. I don't need, that's not my business. Those negative ones are not my business. But I read one. My favorite was, Dr. Jones is great. She needs a massive raise. And I was like, yes, thank you. And then I actually checked it a couple months later, and it was the same person who goes, Dr. Jones is still great. Has she gotten her raise yet?
Oh my God, that's so sweet.
And anyway, so reading those is like really lovely.
Isn't it amazing though, if you get to a point where you're not only advocating for the patient, but the patient is advocating for you?
They're so sweet. Yeah. And another thing about these West Coast patients is that they live a really long time.
Ooh, tell me more.
Well, I'm doing an IPP replacement on an 86-year-old in July. Yeah. He was using it and he had had it for like 30 years. And
Well,
all of a sudden he couldn't get it to go down. And then he came in and I was like, oh, it feels like there's a leak, bro. So we got him down and he's like, well, can I get a new one? I said, sir, you are 86, but he's using it.
amazing.
And
That's amazing.
he's like healthy enough for general anesthesia.
Yeah.
So yeah, that's just one example. Yeah. People are very healthy and they live a long time out here.
I feel like I'm gonna have a lot of
You got to adjust
yeah.
your perspective a little bit. And when Joe Biden got his prostate cancer diagnosis, oh my God, even still now,
Yeah.
it's like weeks later, I have 80-year-olds being like, hey, should I check my PSA?
What?
And it's kind of a nuanced conversation, but you know, it kind of depends on what else is going on in their lives,
Of
what
course.
their last PSA was.
Of course.
But it's not just the blanket, like, no, you're too old. Because some of these guys live for so long, men and women
Oh,
live a lot longer out here. Yeah.
that's an adjustment that I'm gonna have to make.
I know. Fascinating. Really fascinating. So, I mean, I don't know. And I'm sure my perspective about things would be different and the same as I was practicing like in South Carolina where I grew up, or even in Chicago. Like,
Yeah.
but I feel like I've landed in a really solid place. Yeah. Which is
You've made it sound very appealing. Although I will say, like, it's so funny because when I talk to people about where we're working and like living in California and trying to convince other people,
what do they say? Do they say it's so expensive?
they do say it's so expensive, and all I tell them is, hey, why don't you just come out and visit and just see what it's like, and it'll sell itself.
Works for you.
And I was like, wait, that's exactly what happened with
I was like, don't let me convince you. Don't let me.
No, you were like, even when it came down to where we lived, you were like, no, don't let me influence your decision. It's gonna influence it. Like, it's gonna influence you regardless. Like,
And now you're down the street.
now I'm down the street.
Straight. And our dogs can play together.
Oh, wow.
Happy Pride, by the way.
Happy Pride.
Yeah.
Wow.
Have you done any Pride things?
We went.
Not that y'all haven't had an absolutely major last month.
It's been kind of a crazy month. A lot of things have happened. My partner has moved out here before I did, just for his job, and is in a short-term rental right now. And so we did a half country, 2/3 country road trip.
Cross country.
Cross country road trip.
Yeah.
Yeah. And like a lot of things that we kind of took for granted while living in Chicago while we were there. Like, we drove through a lot of areas that we had our guards up quite high.
Interesting.
And it was something that I hadn't thought about in a very long time, because living in Chicago, you really don't think about it as often.
But like safety.
Yeah, our safety and what we look like and how we are perceived by the people that are around us, that are staring at us with their mouths open. And I remember kind of certain instances where we didn't feel as safe as possible, as we could, and we left as soon as possible, just because of like all the looks that we were getting. I mean, we're an interracial gay couple. We have a corgi, a very handsome corgi, and but we stand out like a sore thumb. But in the middle in some areas, we stand out very prominently. And so it made me kind of recalibrate where I was and where I'm, I guess, like, why. It reminded me of why I made the decisions in my life that I wanted to make, and where I wanted to work, and where I trained and where I wanted to work were very similar. And a lot of it comes down to how I felt in the workplace, how I felt in the community. Was it a space that I could grow roots? Was it a space where we could grow as humans, and be respected, and also offer something to the people around us?
Yeah.
So it was definitely something that I had thought about, and we had thought about for a very, very long time. Because, as you know, both my family and my partner's families are on the East Coast. Like, so we're moving to very much the opposite coasts, and so it makes it very difficult. But you know this because your family's all out on the East Coast as well.
It is, time zones are a thing. Yeah. Which is one of the reasons, even just when we're 2 hours apart, like somebody in Chicago texts me, I'm like, oh, I'll get to it later. And then I realize, oh, it's like 10 p.m., like whatever, I don't know. So I should really just use the very convenient iPhone feature of like sending your text later.
Oh yeah.
And he's like, send during business hours. But that technology eludes me sometimes. So anyway, that's why I got to the point where I was like recording some voice notes sometimes and using my commute on the way home to like catch up with people if they were still awake. But yeah, it is challenging. Like my mom is on the East Coast, and I, if I get out of the office or the OR around 6 my time, it's 9 her time, and she works out. And early in the morning, she wakes up at like 5 to work out. So I'm like, geez, Mom, don't wait up for me. But yeah, it has been a big change, and I have learned some like tricks for like flying on red eyes.
Okay.
Back to the East
You're gonna have to
Coast.
share all those with me.
Yeah, so I have quite a collection of like airplane pillows and just stuff on to like get myself comfy on my red eye flight. Yeah. Anyway, so it's it works for now. I'm very happy where I am, and I would love to move my family out to be with me or whatever. But it is what it is.
But your family also talks about when they come out here how different, but like different in a good way.
Yeah.
It is, right? Surprisingly how like nonchalant or how non-issue some of these things that we talk about constantly are. And I feel like, I mean, if you think about conversations about trans care and gender diverse people, I feel like a lot of people who are talking negatively about it just don't interact with it.
I know.
Other than talking about it. And I feel like it's kind of a weird space to be if you've not really interacted with
hold an opinion so strongly.
Yeah. So when you haven't really interacted with any gender diverse people to begin with. And to realize how when you're in a space where everybody in the community is welcomed and everybody in the community is accepted, that really is just not an issue. And you can just see the person for the person and live your life.
Yeah.
So it's quite interesting to hear when people come out and visit and say, hey, like, actually, I really loved it. And because that was my experience when I moved out or when I came out and visited. And when I experienced what it was like to be in the community and realized, wow, and not only like experience the welcoming environment that I felt, but also looking around and seeing people just like me, right? And people looking like us, right? Like and really understanding that everyone here is just living their lives and doing the best they can.
By them. Just trying to enjoy this.
Yeah.
Yeah, it's interesting how I remember when we moved to Chicago, and I feel like a lot of my family members were like, "Oh my God, watch out. It's so dangerous." And I was like, "But have you ever been there?"
Yeah.
And then of course we spent 6 wonderful years there. Love the city. And
they're visiting every single year.
Yeah. It's like, yeah.
Yo.
And then it's the same thing out here. Like we've had our parents visit, and they're like, "Oh, this is so nice." I'm like, "Well, it's just life.
Yeah.
Like we're just out here. Like you can't believe everything you hear on like whatever news channel you listen to, I guess."
Yeah.
But yeah, it is interesting how people cling to these ideas, really strongly cling to these ideas about human beings that they've never encountered, never met.
Yeah.
And it's really fascinating. I do think I have encountered plenty of sexism out here.
Oh, okay.
As a female and I don't know, female presenting human being. Like oh, you're the surgeon, you're the one who's going to do the surgery, that kind of thing. I definitely got it in residency, but now it doesn't feel like there's a reason for it.
Yeah.
Because I'm like,
but you're the surgeon.
Yeah, like it's my name on your paperwork when you come to see me.
Yeah.
It's my picture.
Yeah.
Like, and not that I need to present a certain way or pass or look like anything. Like, no. But it's just sort of like, I feel like they knew what they were getting, and here I am. Like, and I don't understand the questions or the concern at this point, especially when it feels like it's coming from a place of, I guess like it's, and I guess that stuff never goes away no matter where you live. And also
think about
like kind of what we mentioned last year, where people, if I'm straight presenting, they feel comfortable being homophobic around me, like every now and then. It's like, I walked into a patient's room a couple months ago, and the patient's like, "Oh my gosh, a last name that I can pronounce." And I was like, "Whoa."
Oh man.
I was like, what do you mean by that?
Yeah.
He's like, well, you know all these other names out there. I'm like, no, I don't. I was like,
Yeah.
they're pretty straightforward. Many of them are 2 letters.
Yeah.
Very easy to say.
And in fact, oftentimes we introduce ourselves by our last name, so you know what to call us.
We do. Oh, it's that. And my first name really, really confuses people
Oh yeah.
because they're expecting not a white person, I think.
Oh really?
Like, even though my picture is associated with it,
Yeah.
somehow, like, I don't know, old people don't use it.
Yeah.
So they see the name. Maybe it's not a white woman that they're expecting. I don't know.
But there's a kind of implicit bias.
Oh, yeah. Oh, yeah.
Yeah.
I
Right.
cannot tell you. And it's far more now. And I think it's just because my name's on the paperwork and on the sign on the door and stuff.
Mhm.
But like, it's so much more frequent now that people are like, where's your first name from? Or how do you say it?
Oh, interesting.
And when I'm really salty or stressed out, I'll be like, oh, it's doctor. It's Sears.
But I mean,
But I'm like, it's never coming from a place of like genuine interest. Almost never.
really,
Almost never. Especially
I
it's the first thing out of your mouth when I walk in the room.
it definitely speaks to a lot of implicit bias, and I think that yes, absolutely, moving to places in the West Coast is not an escape from anything, and by no means do I think that we're going to be moving to utopia. And I think it really is then a conversation about how do we navigate that, right? Like, and
Yeah.
yeah, kind of accepting that there's always going to be that person who isn't as welcoming.
Mhm.
And I remember talking to my partner about this on our road trip, and I remember saying, listen, I feel like our walls are very high. Like we're not talking as much, but then like what do we do? And you know what his response was? And this is why I love him so much. His response was, I really am just focused on when in that situation about being kind. And just being
Yeah.
a human to that person, because that might be their only experience, or that might be their only experience with someone who is gay in an interracial couple from one of the coasts.
Yeah.
And and if you leave that impression,
No.
no, but if you leave the impression that actually, yeah, their implicit bias was correct, then I feel like maybe we do leave them in a worse situation than. But it does require but it requires for us to kind of navigate that on top of being stressed in our jobs and having to navigate if our mind share really isn't in a space where we can give a little bit of grace. Then
I think
I was humbled by that because
that's the kindest, sweetest thing. Yeah.
I was quite salty. And
Right.
I said it, I told him that our walls were up almost as a way of kind of being almost proud, because we were like, okay, like we're only here temporarily. But he saw it as a way of like, well, why don't we be open, and why don't we show that, like, yeah, just because you're gay doesn't mean that you're whatever the stereotype. Yeah, like we're
Just existing like a normal human.
Right,
Guess what?
exactly.
You also need to fill up your gas at the gas station.
Yeah,
You
guess
know,
what? We're actually really nice people. Get to know us.
surprise. Yeah. No surprise to no one. Yeah. I think when I, get in my zone of like complaining about people's perceptions or ideas of me or, their biases, I think it is coming from a place of privilege for sure, because I think that and maybe it's the level of the comfort that people have with me. Like they look at me and they're like, oh, she's going to be in on this. Like she can understand.
Interesting.
And so it's almost this like aggression sort of, it's like, Adam, that's just probably way too much, but it's like this sort of like reaction formation for that part of me. I don't know. But I do think like I can get away with being a little more direct with people. Maybe.
I don't know if it's being direct. I think a lot of it is just standing up for yourself, and
Well, yeah,
also
that's-
but also realigning the expectation, right? Like you
Yeah.
are, in fact, the surgeon, and a pretty damn good one.
Yeah.
So I think you should be respected when you're in the room, and especially if the patient is asking for what you would do, and especially if they're there with a specific situation. Honey, you were trained for 6 years to be able to help
Yeah.
in that situation.
And I will say all of my colleagues, all of the staff, like absolutely incredible.
Yeah.
Like I feel so well supported and taken care of.
Yeah.
So I think, yeah, every now and then when I get like an old cranky patient or something,
Yeah.
well, I like get it back to them, especially if it's an old, like, old cranky man. I'm like, I can out cranky you. Like, what? Like, let's go. Let's go.
I feel like though that like it does speak to institutions that really are still speaking up and are still trying to promote a culture and an environment that, because my institution is very much the same way. And in fact, in my exit interview, they asked me what my experience was like as a provider there, and what my experience like was as a trainee and as a doctor there, and were you subject to specific biases, were you subjected to specific encounters that were actually quite negative, and tell us more about this, and what, like, do you feel like the institution could do something better for this? And props to all the ones that are standing up to
the assault on DEI.
Because I think that now more than ever we do need to just be here and be present and vocal about the fact that, like it is important, and this is why. Because when whether or not you're driving cross country and feeling unsafe, or you're in a doctor's office and you're being with your pants off. Like, I feel like everybody deserves to be safe. Everybody deserves a space. And deserves to just be respected as a human being. So I think now more than ever is exactly when we should be vocal.
And it's not just the organization's responsibility. It kind of does land on us.
But here we are. Oh my, we're part of it. We're a part of it.
Yeah.
My gosh. It's been a year.
I know. I'm so ready to work with you.
I cannot wait. Everybody who knows us is like, yeah, of course this is gonna happen.
Really getting your office ready.
Oh, amazing. I cannot wait. We have these bubbleheads. They're going in our office.
Yes.
Are we sharing an office, or are we?
No. Well, not for now. Who knows?
We're next doors.
We're very close.
Okay.
Right there. We can yell down the hall at each other.
Good. I'll be yelling if I don't hear from you.
Yeah. Andrew, help!
Wow. So I can't wait. Who knows what 5 years is gonna look like?
Oh my God. Oh, I can't even. I literally get through the day tomorrow, one day at a time.
Go us.
Go us.
Go us.
Cheers.
Cheers to that.
Yeah. All right.
This has been an AUA News Inside Tract podcast. Thanks for listening. For more episodes of this podcast, visit www.auanet.org/podcast.